Welcome to Treatment Tuesdays, where we go over psychiatric medications. In this video, we're going to go over 5 difficult to remember medications and their brand name, generic and brand names, how to link those together, how to remember those. I'm going to give you super easy and fun mnemonics to help you remember these difficult medications and their brand names. And then at the end, we're going to go over a bonus material on the difference between 2 different medications. The first medication we'll go over is, how do you remember Lumateperone is Caplyta? Lumateperone is the generic name, Caplyta is the brand name. The image we're going to have is Lumateperone is a lumbar pepperoni and Caplyta is a cap lettuce. It's a lettuce cap. And the story we're going to remember is, imagine eating your lumbar pepperoni with your cap lettuce in your meal to get your vegetables in. So you're basically eating both. You can imagine them really, really big to make it more memorable. And you can imagine the pizza grease is running down your face and maybe you have to dab it with the cap lettuce. Now, how do we remember Iloperidone is Fanapt? Fanapt is the brand name, Iloperidone is the generic name. For Iloperidone, we're going to imagine an igloo leopard dome. Iloperidone, igloo leopard dome. You can see the picture there. And for Fanapt, we're going to imagine a fan apple. Fanapt, fan apple. For the story, to tie these 2 together, we're going to imagine a gigantic apple fan blowing huge gusts of apple rain at the igloo leopard dome. You can really imagine the apples just pelting that dome and destroying it to bits. That'll help you remember it better. Now, how do we remember and link Vortioxetine to Trintellix? Trintellix is the brand name, Vortioxetine is the generic name. For Vortioxetine, we're going to imagine a Vortex-tine. You see the picture there on the bottom left. Vortex-tine is a teen that makes vortexes. And for Trintellix, we're going to imagine a translucent helicopter. Trintellix, translucent. So the story to link these 2 together is, imagine there's a severe turbulence when flying in your translucent helicopter because Vortex-tine is shooting huge vortexes at it. Huge wind vortexes. So that's how you link those 2 together. Now, number 4, how do we remember Vilazodone is Viibryd? Viibryd is the brand name, Vilazodone is the generic. For Vilazodone, we're going to imagine a Villa ice cream cone at the bottom left there. You see that. And for Viibryd, we're going to remember a vibrant bridge. That's on the bottom right. Now, how do we link these 2 together? Well, imagine the huge Villa ice cream cone being shot at the vibrant bridge and breaking and spilling all its ice cream all over the bridge. So number 5, how do we remember Viloxazine is Qelbree? Qelbree is the brand name, Viloxazine is the generic. So for Viloxazine, we're going to think Viloxazine. Zine is always going to be zoo from now on. Viloxazine, Viloxazine, that's on the bottom left picture. And Qelbree, queen bee. That's on the bottom right. So the story on how to link those 2 is, imagine a swarm of gigantic queen bees attacking the Villa Ox Zoo, and they have a battle, the oxes and the bees. So here's the bonus material. So these 2 medications sound almost identical. How do we keep them different in our head? Well, we're going to compare here Nefazodone to Vilazodone, also known as Viibryd. Vilazodone is Viibryd. So Nefazodone, we're going to imagine a neon fedora. Nefazodone, neon fedora, as you see in the picture there. Fedora is a hat. If you remember, Vilazodone is the Villa ice cream cone. Vilazodone is a selective serotonin reuptake inhibitor, an SSRI. It's also a 5-HT1A partial agonist. 5-HT is serotonin, 1A is a receptor on the presynaptic part of the neuron. Now, Nefazodone, the neon fedora, is different. It's a serotonin and norepinephrine reuptake inhibitor, and it's also a 5-HT1A agonist, so a serotonin 1A agonist. However, it blocks a few other things. It blocks 5-HT2A, it blocks 5-HT2C, and A1 or alpha-1 receptors. Nefazodone also has a small risk of liver failure. Important to remember. To remember that risk of liver failure, you can imagine you're turning yellow/green from liver failure. So the neon fedora is green. That's how you can link those 2. And that's how you can keep those 2 separate, Vilazodone and Nefazodone, even though they sound very similar. Now you have completely different pictures to imagine them by. Here's the sources we used today. Let me know in the comments below what you'd like me to cover next.